And then finally, think about last mile delivery. So that's my Carol, Q-A-R-O-L. Okay? Last mile delivery to the farthest, as you've seen even in the video. Our branch in Kisumu was opened by none other than His Excellency, the Governor of Vihiga, Otichilo. So we have been working very closely together, and we are looking for room to even work even better. So in the interest of time, maybe if you're allowed to be able to field a few questions or comments, then we'll be able to live within our 15 minutes.
That's for later. I want to call upon Path. Just so you know, that very beautiful Moroccan design building you saw at the beginning, it's my level 5 hospital, eh? Oh yes, thank you. Yeah, thank you. Can we call then?
And it has medicine from Meds.
And can we call Path also, please? Take a short time as well. I think you've explained yourself very well, and everyone knows about Meds. Thank you, CEO.
So Your Excellency, Chair of the Council of Governors, Your Excellencies, Governors, the CEO of COG, distinguished guests, ladies and gentlemen, good morning. Still morning. My name is Rachel Dirango, Regional Director for Advocacy, PATH, and I'm honored to represent the PATH Kenya Country Director, Caroline Njuguna. I sent her regards and her apologies for not being able to join this important forum. I'm also joined by my colleague, Melissa Wanda, who leads our policy and advocacy work in PATH, and she has worked with a number of you, Your Excellencies, represented in this room. On behalf of PATH Kenya, I extend our sincere appreciation to the Council of Governors for convening the political economic transformation agenda, which includes health or UHC agenda, and through the expansion of primary health care, health insurance coverage, strengthening health systems capacity, and health data systems. For those who may not be familiar with PATH, and you can actually take PATH to mean PATH to UHC. And our mandate, our mission is really to accelerate health equity through partnerships and innovations, hence the reason why we are here. At the core of our work is the belief that investing in primary health care and investing in health is really vital to saving lives and building prosperous, resilient societies, because resilient societies are a foundation of economic development. And over the past 30 years that PATH has been present in Kenya, we've built trusted partnerships with the government of Kenya. As I've said, health systems, primary health care, building capacity, access to technologies, and creating an enabling policy environment to drive health equity, with a big focus on maternal, newborn, and child health, immunization, non-communicable diseases, HIV, and TB, just. But not the implementer of the largest HIV prevention care treatment program funded by the US government, working closely with county governments, a lot that are represented here, to deliver intervention particularly in about 7 countries in the Western region. And so this gives us the experience, firsthand of understanding the real and potential impact of the recent disruptions and reduction in external funding. So as you're also feeling that heat, we are very much aware. And so this reality calls for doubling down on efforts to build sustainable health financing priorities. Of course, leveraging on social health insurance as a key driver to reduce out-of-pocket expenditure. PATH's work in Kenya is anchored on primary healthcare, as I've said. And to this end, we've partnered with the Ministry of Health, the Council of Governors, in the rollout of primary healthcare networks across the counties. And for many years, we've also worked with the Council of Governors to strengthen county health governance structures. I'll mention just a few, of course, working with the health committees, the CECs, the chief officers, the county health directors, caucus. And we have collaborated in the inaugural health committee induction using the induction manual that we developed together with the Council of Governors. And we want to applaud the Council of Governors for all your excellencies for the drive towards the reduction of preventable maternal, newborn, and child health, including leading from the front under the Intercounty Maternal and Perinatal Death Surveillance Response Initiative launched last week. We look forward to partnering further with all you, your excellencies, to bring those commitments to deliver our mothers and babies as we work towards achieving UHC. It has also been very refreshing to see your leadership, including attending those 7 a.m. weekly MPDSR meetings, just showing the commitment that you bring to this agenda. At this point, allow me to also applaud specifically some of the champions in the room that we've worked with in this area. Of course, the governor from Makueni for driving PPH down and showing that it's possible to keep mothers alive. Now the Council of Governor has developed the MNCH investment case. PATH looks forward to working together with the counties to implement the key priorities. And just so that you know, PATH also works closely with the County First Ladies Association, in case you hear this at home, for a number of years. And we have helped the CFLA to develop their first strategic plan, 2020 to 2023. And as I speak here, we have finalized a new version of the strategic plan with them, which will run up to 2028. And this is due for launch tomorrow, actually, in Nairobi. As I conclude, we call for stronger investments for primary healthcare. So even as you deliberate, that you may keep in mind that investing in PHC delivers, strategic health and economic benefits. And we know, all the benefits. I may not go through them because of time, but we must keep in mind that for every $1 invested in primary healthcare, we save up to $16 in future health financing. Who doesn't want to save money? And who doesn't grow the economy through even more savings and investments? And so primary healthcare is an investment and not a cost. On the flip side, the cost of not investing is really measured not only in lives lost, but in futures foregone. And I know for policymakers and governors, every life counts and every life matters. So where you can save life, I know that is top on your agenda. So as I finish, I would like to table some key asks as you deliberate and develop a joint position on UHC. We urge you as a key partner and key stakeholder in the health sector, Your Excellency and the Council, to prioritize increasing and protecting county primary healthcare financing, including ring-fencing a minimum percentage of the county health budgets for primary healthcare and ensuring timely availability of funds at the facility level through direct facility financing. We also urge you to strengthen your roles in social health insurance implementation, scaling up community health services, including the community health workforce for primary health care, enhancing digital health for PHC delivery, and strengthening accountability and citizen participation. PATH remains committed to partnering with the Council of Governors and individual counties, and with a view to actually scaling up to all the 47 counties through partnerships to achieve Kenya's UHC agenda. Thank you all very much, and I wish you fruitful deliberations. Thank you.
Thank you very much, Excellencies. All protocols observed. We've heard from our partners who sponsored us to be here, and they are significant players in this space. Now we'll move on to the main agenda of SHA and the management of UHC. So the key presentation will be made by Governor Abdul Samad and his team from the Health Committee, the chair of the Health Committee. As we move to summit on the 10th of December, I want us to isolate all the problems that we have with SHA in the hope that we will find answers and in the hope that we will get SHA back on track. You know, when something is working seamlessly, you don't have to say that it's working seamlessly, because you'll be told by the beneficiaries, the users, the public, that it's actually working in a very seamless manner without hitches. But definitely, SHA has challenges. From where I sit, I believe it's a well-conceived, from a conceptualization perspective, idea. As governors, we continue to do our best to advocate for SHA. From the onset, when everyone was calling it names and saying this thing is not workable, we stood firm, soaked in all the criticism, and said that this thing must be given a chance. But increasingly, we're also appreciating the serious challenges. Yesterday, I think in the run-up to this meeting, I saw communication from the Ministry of Health that the dashboard which they have been promising, the governor's dashboard, is now up and running. There wasn't sufficient time between then and now. It's running. I hope maybe see you and our team for us here up and running, and whether it gives us the information that we sought. But we've been asking about this for quite some time. In the room when it comes to discussion of SHA is claims management and the whole reimbursement process, the rejection of claims, the late disbursements. The figures that the CEO shared with me, cumulative for all counties, is in the region of you see, it's very demotivating for our staff when they have actually provided the service and the claims they have logged in have been rejected over very flimsy reasons. This is an insurance. Your insurer cannot just reject your claims for nothing. It's not a free service. Someone is paying premiums, right? The matter of not allowing to carry out deliveries, and under the excuse that they don't